The Heart Stroke Foundation is Canada's biggest health charity. Our major focuses are funding research, promoting health systems of care that support people with heart disease, stroke, and vascular cognitive impairment, and improving the lives of those people living with those conditions through different education and services that we provide. So this February, we're focusing during Heart Month on heart failure. Heart failure is a condition that affects many, many Canadians. Over 750,000 Canadians live with heart failure, and every year over 100,000 new diagnoses are made. Most people don't understand what heart failure is. They often immediately think about heart attack and the big Hollywood heart attack with the chest pain. So heart failure is a condition where the heart doesn't pump properly and it doesn't work the way it should. So either the muscles of the heart become too weak or become too stiff, and they can't get enough blood out to all parts of the body to help your body function properly. And that's when we see the symptoms that often come with it of shortness of breath that can come from fluid backup in the lungs, swelling in your legs, your ankles, your abdomen, and this real chronic fatigue. And these really impact people's ability to function day to day. Heart failure is really hard. It's a chronic condition. There is no cure for heart failure. So it's really important that people living with it have access to all of the expertise to help them, get through their day with a reasonable, quality of life and to live longer. So if people are really monitored carefully and provided with that education, the right medications and the right other treatments that are available, they can have a much better life. But we know that in Canada, there's such diversity in getting that. So heart failure is a condition normally seen in elderly people. And with the Canadian population aging, we're really expecting to see an increase in heart failure in the next few years. More importantly, what we're starting to also see is an increase in heart failure in younger people. So younger adults, children born with other heart defects that can lead to heart failure. So, we see many children with heart failure. We see adults with heart failure in their 30s and 40s. A lot of that is related to lifestyle. Sometimes if there's heart conditions in the family, it could be inherited. We know that we're seeing diabetes and high blood pressure showing up earlier in our population because of the stresses and the way our younger generations really have to compete in the workforce. And those are high risk factors for heart failure. So because we're seeing those conditions earlier, we're seeing heart failure earlier. But it's certainly a condition that can be well managed. It tends to be a condition where there's really good periods of stability where you're managing really well with your condition. And then times when it gets out of control, you have an acute crisis that needs, urgent medical intervention. If we can get early detection, early diagnosis, then that condition can be well managed. In the current pandemic, we've seen from very early days that the COVID infection does lead to heart conditions. We know it affects the heart. It causes inflammation of the heart muscle tissues. What we still don't know is how long and how extensive that damage can be in the long run. So we're watching people with COVID who've had heart impact very closely. So that could lead to an increased number of people with heart failure in the future. But also when you combine having heart failure with the stresses of the pandemic and all of the regulations we've had to follow, which have been crucial to helping get on top of COVID, heart failure in general, because it's chronic, does have a major impact on mental health. People living with such a chronic condition where there's days they just don't have enough energy to get out of bed, or in younger people looking after their families, going to their jobs, as elderly people, being able to continue to be social in their community, which is so important. Losing those abilities on top of the restrictions in the pandemic of having to be socially isolated or socially distanced has really had an impact. One of the things we find is people get so caught up in managing the physical symptoms of heart failure, they often overlook or will neglect the emotional feelings they're having. In order to really have a better quality of life, we need to deal with the physical and the mental. We really encourage everybody to think about your friends, your family, people who might have heart disease or stroke or living with these conditions who might be frightened because of the pandemic, to reach out to them, really show some heart, and to look after each other during this time. be aware, learn, take some time to learn about these conditions so that you'll recognize them in yourself and others. Those are such important things. We're working together with all of the major groups in heart failure right now to build an action plan, and really trying to reach out and help move the agenda forward in Canada to try to fix some of the inequities that exist. And we really encourage everybody to come and join us and to learn more at heartandstroke.ca.